Bismillah ar-Rahman ar-Rahim, Assalamu alaikum, and welcome to a very special program of Diplomatic Enclave. I am your host Mohammad. We are here today in Islamabad attending the 64th session of the Regional Committee for the Eastern Mediterranean. This is a committee of different health representatives of 22 countries of the region who are here, about 250 health professionals from all these countries who are here as well, from Pakistan and from these other countries, representing their organizations and talking about health. This has been organized by the World Health Organization. The World Health Organization, as you very well know, is that body that governs all the health issues, tries to find the solutions to all the health problems that persist, that exist in different parts of the world. We will begin our program by talking to the regional representative for the World Health Organization. He has come all the way from Egypt. His name is Dr. Ibrahim Al-Kardani. Thank you very much, Dr. Kardani, to have come here, to have given us the time.
Thank you, but I'm a representative, not the representative, because I'm the spokesperson. Thank you, Omar. It's really nice of you to welcome us here. We felt that right away as soon as we came in Pakistan. The welcome from the airport, Her Excellency the Ministry of Health had sent people with flowers, and everybody in the 250 people who were arriving felt so at home as soon as they arrived.
That is brilliant, sir. Is this your first time in Pakistan?
I came once before around 8 years ago, and to talk about polio, for example, the progress I have seen since 8 years to now, the number of cases has gone down tremendously, and for that, Pakistan needs to be congratulated, really.
Speaking of polio, Pakistan and Afghanistan were two countries that had been sidelined as far as polio incidence is concerned. Do you feel that disease has completely dissipated from the country, or is there still a little bit of prevalence?
Actually, around the world now, there are 3 countries that still are causing the problem so that we can finally eradicate polio from the world. We did that with smallpox before, and it would be really great to eradicate another disease. As our Director General at the meeting this morning was saying, he said both Pakistan and Afghanistan have really done a great job, really a great job. The number of cases have gone down tremendously. However, we need the final push. We really need to give it more. You know, the final push always takes longer. It takes more energy. And so Pakistan and Afghanistan, they're working jointly, and that's wonderful because of the cross-border. But polio can be eradicated. The whole world did it. I just came back from Somalia with the regional director, and they were celebrating 3 years of being polio-free.
Oh, that's brilliant.
So it's brilliant.
In your point of view, or in the World Health Organization's point of view, how many more years will it take for the region to be polio-free?
It depends on how diligent you are. Okay, it will really depend. I know there are many challenges in Pakistan. It's a very diverse country with many different, sometimes hard to reach areas. But we really, together, everybody, the Ministry of Health, the World Health Organization, UNICEF, Bill and Melinda Gates, all the foundations should work together to reach the unreached, to reach the most difficult areas with the vaccine, because that's the only way we will be able to get rid of the virus.
Sir, there are also different other diseases that are prevalent around the world. We get small cases there and now of Congo virus. We have HIV that is there as well. We've got different varieties of cancer. We've got certain diseases that are still being discovered in these times. How is the World Health Organization working to prevent those, to make people understand and give them information regarding these diseases?
Thank you, Omar. Actually, you've touched on several things at once. You've given us the communicable diseases, such as something like HIV. And HIV is a very sensitive topic, especially in our part of the world. How do we discuss it openly? Of course, we know that the means of transmission happen through a variety of ways.
Exactly.
But most amongst them is sexual transmission. So there has to be preventative measures taken, even if somebody is having extramarital sex or sex. There has to be a way to prevent. So we have to educate the young people. We have to educate the public to ensure that the virus doesn't become rampant. We've seen many countries, we've seen the West world, where they have been very open in their awareness campaigns. It has declined considerably. Where countries have been afraid to discuss it, it's still a barrier,
so many
and
countries.
it's expanding. We need to be very open about it. We need to know that blood transfusion has to be excellent shape in the country to ensure that nothing happens through that. We need to ensure that the mother and child transmission through breastfeeding is also taken into account. There are lots of things to take into
Use
account.
of razors in all these hairdressers where they sometimes do not take attention, do not clean them properly in using them between two people.
Thank you for that, Omar. Of course, infection control is a must. Infection control is something that every person who is in the health or somebody working as a barber or nails or whatever has to take care of their infection control measures as required.
All right. That brings me to a question that a lot of people ask me when we discuss HIV, because I've been to the United Nations many a times in the past and talked to the head of the UNAIDS as well. Is there going to be a cure for HIV in the years to come?
I think so. We've come a long way. If you look at now, there is treatment. I hope everybody knows that treatment is available for HIV. We don't say cure, but we say treatment.
All right.
It has become like a chronic disease. It has become like diabetes. If somebody takes their drugs, they used to be 3 tablets a day. The antiretroviral drugs now have become only 1 a day. So we've advanced a lot. We know people who are living with HIV for 15 years, they're very productive, they're even having their own children now. So things are under control to a large extent. Whether we will get a drug like the hepatitis that gets rid of the virus completely, now hepatitis B and C have really also come a long way.
True. That is true. That is true. Sir, we're here for the Regional Committee of the Eastern Mediterranean region. What is the roadmap of the World Health Organization for the years 2017-2021 for this region?
Dr. Fikri, when he took office, actually had the roadmap set along with all the partners to decide. Of course, it's pertaining to the Sustainable Development Goals. We've taken into account Goal 3 especially, which pertains to health. And he's outlined several topics. Foremost amongst them is emergencies.
All right.
Our region is filled with emergencies. We have, if you look at Syria, at Yemen, at so many areas, we have natural and man-made disasters of every kind in the region, conflict. So he's highlighted that it's the most difficult place to work when there is an emergency. And WHO has come a long way with that. So that's part of it, emergencies. Non-communicable disease, and these are the diseases that are affecting a lot of people in our region. When we talk about cardiac diseases, heart, hypertension, diabetes, these conditions are also affecting a lot of people. So he's highlighted that, what we need to do about them.
Cancers.
Cancers, of course. And we've come up with a kit. Now WHO has come up with a kit for non-communicable diseases. And that is actually for 15,000, I believe. I can't remember the exact sum of money, but it's very reasonable because it works very well in areas of conflict where there are emergencies, where our hospitals are not working well enough. So we managed to get through a kit, which has just come on the market, to be able to use in these places. Then we talked about communicable diseases, all kinds of communicable diseases. You've mentioned them,
yes.
Like one of them is HIV/AIDS. And the last part is health system strengthening. No country in the world can work without having a strong health system to depend on. In some of the poorer countries, we know we live in a very diverse area. Again, we have the richest countries in the world and we have some of the poorest countries. So where we see the richest countries, you find that everybody has access to healthcare. It's the poorer countries when we find the people having to pay out of their pocket. And this is something we don't want to stand for. We really want the poor person to be able to get their
The
health.
same kind of benefits that the rich people are getting.
Exactly. And this is actually the roadmap of our regional director, Dr. Mohammad.
When you talk of developing countries, those countries in which people cannot afford basic health facilities, how important do you feel is the role of the government and the private organizations of those countries in collaboration with the World Health Organization?
Private-public partnership is one big challenge. Everybody works on their own, and all ministries of health try their best to give services with what available funds they have. Health needs to be put on top of the agendas of all the countries, actually. More funds should be made available for health and education. We always say that when that happens, the country is advanced very fast. But in the present situation, one of the ways to work around it is to make sure that the private partnership partners with the public sector. The public sector would have a regulatory mechanism to make sure how this happens. Engagement between the two is very important, and that is what WHO is trying to do.
All right, that's brilliant. Sir, coming to Pakistan, where this very important committee is being held, there are a lot of meetings that were held. The President of Pakistan was there as well. You've also launched the Pakistan Hepatitis Strategic Framework for the years 2017-2021. Could you highlight some of the important points of that program?
Actually, we were enthralled that the President of Pakistan was inaugurated our meeting. It was such a thrill for us because to have such a high-level commitment from somebody at that level was something very, very special. So I think hepatitis is very prevalent in Egypt and in Pakistan. They form 80% of the cases in the world. Egypt has started its program, and actually 1 million people have been treated in the past year. The medicine has been made available. It's cheap, and that is exactly what Pakistan is doing now. They're making it much cheaper, available, so that most people can have access to treatment. So we have to be careful with that. We have to make sure infection control. Make sure you have a separate razor when you're shaving. Make sure the syringe you take for any injection is yours alone. Don't let a syringe be used by several people. It's very, very important to make sure of that. And so, yes, the hepatitis program has been launched in Pakistan. We're hoping to see the fruits of that very soon. We're hoping that the medicine that will be made available at a cheap price will be able to be accessed by everybody.
How important and how strong have you seen the commitment from the Pakistani side since you've been here? And even when you're not here, you're in contact with countries such as ours on different health issues. How important and how strong has that commitment been?
Actually, Omar, I mean, I started off by thanking Pakistan. I want to end by doing that too. The commitment has been incredible. We felt at every level, and every time we come to Pakistan, we find something new being done in the field of health. Pakistan is the biggest country in the region, over 200 million population. It has a lot of challenges, and we understand that very much. But the government is taking that into account, and they're trying very hard to, counter these challenges. So we really, really hope all the best. We felt the gentleness and the hospitality of the Pakistani people to a very large extent. Thank you again, and thank you for this interview.
But I have one or two important questions, because it's not every day that we get to speak to the spokesperson of the World Health Organization, is that? And of course, you have a regional and I mean to say a global point of view on the health issues, on how they are being prevented, on how they are being treated. There is one issue that's very important, that is antimicrobial resistance. A lot of people are getting resistance to the different drugs that they are taking. Sometimes the doctors prescribe too strong an antibiotic, and the next time the patient takes it, those germs that are inside refuse to be treated by those antibiotics, and then it gets stronger and stronger to such a level that your immunity gets to go to a level that is nil, and then you get other diseases as well.
I want to thank you for this question, Omar, really, because this has really been irking us. Antimicrobial resistance is now becoming on top of the agenda in many places. There is panic worldwide that the public is misusing antibiotics. If I have a cold, let me take an antibiotic.
True.
And then as soon as I feel better, I throw away the antibiotic.
A sore throat, you take an antibiotic.
And then your daughter or the other son feels sick, give him the rest of the antibiotic. This is very dangerous. This is really dangerous, and we don't want it to happen. Don't take an antibiotic unless it's prescribed by your physician. Don't take it over the counter, please, because what you are doing when you do that, when you don't complete your dose that is prescribed, you are creating resistance. Soon we would not be able at all to cure people from many diseases because this resistance is growing and growing. And this is in your hands. It's in the public's hands. We need very much to assist the governments with the Governments need to raise the awareness. They need to make people careful how they use the antibiotic, when to use it. Not every cold. only during bacterial colds. If you're viral, you will not gain anything by taking an antibiotic.
But how does one increase one's immunity in countries that are still developing, in countries that might not have access to clean water, might not have access to food that has all the vitamins and minerals in it?
We come back to poverty again, and that's why we have to alleviate poverty from the whole world. We have to make sure that clean water is available everywhere. It's the essence of everything. But I can give just a few, like a small prescription.
Please.
Just, I mean, sleep early, wake early, eat as best as you can, keep away from fried foods, and that I've seen a lot in Pakistan. Of course, you have to try and make your diet less fried foods.
What about the spicy food?
The spice is great. I love it too. No, but spices are not as bad as, you know, frying with oil and stuff like that. And of course, lots of fruits and vegetables are recommended. So just make them as clean as possible. Try to have a healthy life as much as possible. Exercise as much as possible. If you're parking your car, park it far and walk. If there's an elevator, take the stairs.
There's also this
There's
thing,
the
we
simple
no
things in
longer
life.
want to exercise, we no longer want to walk.
Exactly. Everything seems to be right around us, even your computer and everything.
Exactly.
You're sitting down. So you have to move as much as possible. Moving is very healthy. Keep away from smoking. Keep away from other drugs. Keep away from shisha. All these things that are in our areas have to. For young people, please be careful.
From smoking, we come to cancer, sir. One of the very important mandates of the World Health Organization is prevention and scaling up cancer prevention and cure. What are the latest efforts in that regard?
I think, of course, cancer is being discussed in a special topic in this regional committee because we are seeing it really increasing very much, or maybe it's being discovered earlier and all that. Of course, the earlier you discover it, the better it is. So please don't be scared to go for checkups as much as you can, because the earlier you find it, the easier it is to treat it.
True.
So that's one big recommendation that we hope people would go by. And the paper will be read soon in the afternoon session. We'll get into more details with that and come back to you later.
And one final question. I know you're itching to go and talk to all the other international delegates who are there. Adolescents, whether in Pakistan or around the world, are not that informed about the correct way to eat, the correct way to prevent themselves from different diseases. There's a lot of prevalence of diseases that happens due to misinformation, miscommunication between them. How to prevent that, and what steps is the WHO taking in that respect?
Again, mother, child, adolescents are taking a large portion of WHO's interest at the moment. Adolescents are very pure, but they need very much they need their guidance. We need to raise their awareness all the time. We need possibly to educate them at an early age with things that we normally wouldn't have talked about in our generation. But now they have access to the net. Everything is available to them.
But so there's also misinformation on the internet.
Absolutely. But that's why we need at homes to protect the children as much as possible, shelter them, have communication with them. Always speak to your child, and more important than speak, listen to your child. Listen to what that child is saying, because they are different generations and we have to bridge that gap.
All right. Sir, climate change, something
You've
that is
read
affecting
every single paper, Omar.
this is one point that is really affecting the whole world, including Pakistan. We've got summers that are getting hotter and hotter, winters that are getting smaller and smaller, shorter and shorter. It's not the same anymore. There's no real autumn. There's no real spring. But that also brings us to different diseases that come more often, that come strongly every year. How does one prevent climate change, and what is the WHO's mandate on this?
Actually, climate change is one of the main topics being discussed, because we have all felt worldwide the effect of climate change, whether it be in the Americas, where in South America, Africa, everywhere we are feeling this. And we are seeing the effect of climate change on a lot of things pertaining to health. And more studies are being conducted because it's a relatively new happening for all of us. And we're trying to come up with what needs to be done for a human being to be cautious of, to be aware of in order not to fall prey to any of the climate changes that are occurring to the human being.
All right, so the importance of climate change and the work that the WHO is doing in respect of that, whether it be at the UN body or in conjunction with different countries, is also very important. But sir, not only communicable or non-communicable diseases are important, but also psychological diseases, mental diseases, depression, anxiety lead to so many other diseases, lead to people committing suicide and other diseases because their immunity gets low as well. What is WHO doing in that respect?
WHO is really taking that into consideration. That's why the theme of World Health Day this year was depression, let's talk. It's very important if you see somebody who is depressed is to give the hand, listen, and try to make this person get out of whatever depression they're in. It occurs at all ages, it's affecting everybody, and we need mental health. In our region also, we have the depression is very high because of the conflicts, because of the disasters that are occurring, because of the migration and leaving your home. All these things are more and more affecting the mental health of people. So it's put higher in the agenda along with the other non-communicable diseases. And they made World Health Day for this year, especially on that topic.
All right, that's great. And finally, all those who are internet conscious, who know how to access Google, what are the sites that one needs to go to get the relevant and correct information?
You have the EMRO site, EMRO, and in our bulletin this year, we've put these, you can later put the camera on, these are all the Flickr account and all the places where you could go to get information, especially as regards RC64.
Dr. Ibrahim, thank you very much to have given us all this time. I know you had such a lot of other commitments.
Okay, my pleasure.
But it's a pleasure to have you. It's a pleasure to inform not only myself but all our viewers through our channel about the different diseases that exist and how to take care of that. But most importantly, one should need to go to a doctor and consult the right information when it comes to different diseases. And the World Health Organization in that respect is doing its utmost. Dr.
Thank you.
Thank you very much.
Thank you very much. Thank you.
We'll be back after a short break. Stay with us. Welcome back. You're watching this special episode of Diplomatic Enclave where we're discussing health, regional, global, Pakistan's efforts in that regard, and this committee that is here of the Eastern Mediterranean region, 22 different countries, representatives from these countries, health ministers from different countries that are here to discuss the health problems that are prevalent in the region and how to go about. This has been organized by the World Health Organization, and now we have the opportunity, the pleasure to have the Minister of Health from Oman. His name is Dr. Ahmed Mohammad Saidi, and he's now joined us to talk a little bit about Oman, Pakistan, and different efforts that Oman is doing, as well as his perception of how good Pakistan's efforts have been to prevent different health issues. Thank you very much, sir, to have joined us.
I congratulate my colleague, the Federal Minister of Health and Regulation of Pakistan, for her election as the president of this session. Yesterday, of course, we were delighted that the session was opened by the Honorable President of Pakistan, and his presence gave all of us the encouragement and increased the momentum to do more toward health care.
Sir, could you tell us a little bit about the bilateral cooperation that exists between Pakistan and Oman?
Oman and Pakistan relationships, of course, in all aspects are historical and very deep-rooted, and they lasted the tests of turbulence in the region. We continued to be stable, we continued to cooperate, we continued to discuss several issues between the two countries. Oman, by the way, is the closest Arabic country to Pakistan geographically, and I hope it is closest in many other aspects as well. And the friendship and the admiration and the relationship at all levels between the two countries is great.
So, what do you think of the efforts that are being made to bring Pakistan and Oman together on one platform on issues such as health?
Health system in Oman, of course, benefited a lot from our brothers and sisters from the Islamic Republic of Pakistan from human resources point of view. And we aim and hope to have more. I would talk briefly about the cooperation first, and then briefly I'll talk about our healthcare system in Oman. To start with, also, I would like to congratulate our brothers in Pakistan for launching the day before yesterday the treatment for hepatitis viruses, which is a milestone in healthcare and which will cure, not only help cure many patients who are suffering from these viruses, which are unfortunately known to have very dangerous consequences. Secondly, also, I would like to congratulate the government and the public of Pakistan for the very significant improvement in polio eradication. Over the last few years, the commitment from the Pakistani government, the cooperation from all provinces in Pakistan helped, of course, toward reducing the number of cases, because as we know, Pakistan and Afghanistan, unfortunately, the only two countries in the world who still have cases of polio. And with the effort they've been doing over the last few years, we are hoping and aiming to eradicate polio from our Eastern Mediterranean region. Oman contributed, of course, toward the eradication of polio. 2014, there was a meeting in the region, and I represented my government, and there was a lot of input from us, both technical and otherwise, and the results of that, the fruitful result, we started to see now.
So, could you tell us a little bit about the health situation in Pakistan? Do you feel that over the last years, over the last decades, there has been an improvement as far as health standards in Pakistan is concerned?
The healthcare in Pakistan is progressing, especially after the introduction of the health insurance, which will cover most needs of those who cannot afford it will be covered. This is a great and important step. We all know that healthy nation is a productive nation. So health, productivity, and life, you cannot separate them. So the importance of also having this meeting in Pakistan, many of us, including myself, unfortunately, are the first visit. And we were pleasantly surprised by how beautiful the country is. Of course, we knew how nice the people were. We interacted with our colleagues and friends and brothers from Pakistan before. But also, Islamabad is very nice, peaceful, quiet, scenery city. So in addition to us having the annual meeting of our region, WHO, I think we've discovered many things about a neighboring country, and I'm hoping to see more of it. In Oman, healthcare before His Majesty Sultan Qaboos took over in 1970 was almost non-existing. We had primitive health centers and hospitals. And our health indicators, which people in healthcare will recognize, were very poor. I'll give you an example. In 1970-71, His Majesty took over in 1970, our life expectancy in Oman, i.e., the majority of people do not exceed the age of 50. So life expectancy in 1970 was 50-51. Today, the life expectancy jumped from 50 years to 77 years. The death in children and newborn was very, very high in 1970s. It was about 20+% of babies who were born before 1970 did not see their 5th birthday. They were dying from malaria, tuberculosis, other infectious diseases. Today, that number, instead of about 200 per 1,000 deaths, today it's less than 9.5. Of course, in all other indicators of health issues, is tremendous improvement. And I'm proud and glad to say that Oman was rated by many UN agencies as the fastest growing country in human development. Of course, this would not have happened without help from friends allies and organizations such as our brothers and friends in Pakistan.
So what do you feel is the role of the World Health Organization in organizing such conferences? What is the importance of such conferences for Pakistan, for the region and for the world?
WHO, of course, there are several regions, and our region called the Eastern Mediterranean region, which encompasses 22 countries, basically from Afghanistan to Morocco. And we have annual meeting, usually our headquarters in Cairo, but there are occasions where the meeting is hosted by a country like our brothers in Pakistan this time. We hosted it in Oman 2012. Of course, WHO considered to be the reference for healthcare worldwide. All the policies and regulation are either set by or adopted or approved by WHO. So the importance of WHO, especially in our region, is extremely high. This meeting in Pakistan will concentrate on issues that are important to all the countries in the region. Unfortunately, it's a fact also that our region, the Eastern Mediterranean, have the highest number of countries with conflict, with natural disasters, with poverty, with immigration, with people displaced because of conflicts. So the need for the WHO and the countries that are peaceful to cooperate to help other countries and the public in these countries is huge. And this is one of the issues I raised today and I'm very passionate about. In healthcare, we should be an entry for peace and security. We should be actually participating indirectly to make the world more peaceful and pleasant to live in. So that's one issue we'll discuss here. Of course, we've mentioned about the communicable diseases, infectious diseases, and the progress in hepatitis treatment, in polio eradication, in malaria is very obvious, but will also WHO, with the technical support for the regional countries, will strengthen that. One of the issues which we always discuss and we will continue to discuss is what is called non-communicable diseases. These are unfortunately, in the past, they were known to be diseases of rich countries and the Western societies, but not anymore. Diabetes, cardiovascular or heart disease, cancer, respiratory diseases are very common in our region. And unfortunately, because of certain practices, smoking, lack of exercise, very bad diet in certain areas, especially with high intake of sugar, these diseases are an increase and they are very costly for both the individuals and the countries. They are diseases for life. So the person is suffering all their life, firstly. Secondly, the countries will need to provide treatment lifelong, which is very costly. The good thing that 40% of these diseases can be prevented by modifying our lifestyle, 40%. So what I'm trying to say to the public, health is the responsibility of each and every one of you. At home, at school, the workplaces, wherever you are. Health education and information are available everywhere, but we need to look after our health. WHO is definitely taking the leading role in this. In Oman, like many other countries, including Pakistan, we have a high-level committee to compact non-communicable diseases. We are working to achieve the WHO Sustainable Development Goal related to health by 2030, and we have technical support from WHO. So these meetings, annual meeting, there are so many things in the agenda that are important for each country, and we try to concentrate on issues that will improve the living standard for everybody, and we take also into consideration the country's population, geographical variation, their economic situation, so that we don't mix things that are not similar. And this is our second day, and the organization, honestly, I'm not flattering my brothers and sisters in Pakistan, but it's been great, and everybody is delighted to be here.
And finally, sir, I know you're very short of time, you've got a lot of meetings planned ahead, but I just wanted to ask you as to what you feel is the role of media organizations such as ours, PTVworld, in propagating issues such as that of health, of informing the people of important issues, on politics, on different issues. Of course, we are here in this committee, in this important meeting that is being held between different countries under the auspices of the World Health Organization. Do you feel that channels and media have an important role to disseminate information when it comes to health issues?
Well, the role of the media in healthcare is extremely important. They are our partner to deliver the message to the public, whether it's in Oman, in Pakistan, in the United States, all types of media, the social media, TV, newspapers, and there is lots of cooperation between health sector and the social media. What I want people who are listening in your English watching, your English speaking TV channel, as I said before, I'm grateful to be in Pakistan and thankful to the Pakistani government and the public for organizing this very important 64th session of our regional WHO meeting. The hospitality we received is great. Last night we had a wonderful cultural night with, it's called The Color of Pakistan, with various dances from different parts of Pakistan. Everybody wanted actually to stay longer, and it was beautiful. Go back to health. I truly need to re-emphasize that each one of us, in whichever field, wherever they are, is responsible for health. We all know smoking kills, and we need to stop it. We all know that non-communicable diseases, cancer, diabetes, heart disease, respiratory disease, majority of it related to our lifestyle. Therefore, I'm urging everybody to exercise as much as they can, minimum 30 minutes a day, to watch what they eat, reduce their sugar and salt intake, to stop smoking. There's no question about it, it's a killer. And the governments and the health organizations will do their level best to give the right information firstly, to provide the tools for diagnosis and treatment. But who wants to be sick? Nobody. So it's in your hand. You are the one who can make your life healthier and better. We can only provide you with the information, we can provide you with medication, we can open hospitals and health centers. Let me go back to Oman briefly. We have a very strong primary health care where it is accessible to all the public, it's free of charge, and it is the focal point for managing all our diseases. And this, I think, made the healthcare system in Oman one of the best worldwide. And we are ready and happy to share with our friends and brothers in Pakistan all our experiences. We learn from each other. These meetings are not just for appearance in the media, but we learn a lot from each other's experience. We share these experiences, and there are lots of cooperation between different countries in the region. I've mentioned the effort regarding the eradication of polio in Pakistan and Afghanistan. That, without the very high level commitment from the Pakistani government, would not have happened. And all of us in the world are grateful for them to saying, yes, Pakistan will eradicate polio, but they need the help of everybody in Pakistan. Everybody needs to be a health minister in Pakistan and in Oman, everywhere.
Thank you very much, Dr. Ahmed Mohammad Al Saidi, to have given us the time, to have given us the information and your perspective on health issues and the efforts that Pakistan is doing. And thank you for also giving us good words, appreciating our channel in that respect as well.
Thank you very much. And as I said, it's a beautiful city, Islamabad, and we definitely will come back. And thank you again for our brothers in Pakistan for hosting the meeting. Thank you.
Well, that was the Minister of Health of Oman for you. Health, ladies and gentlemen, is a primordial issue, is one of the most important issues that the world is facing nowadays, apart from others. This is an issue that can be treated if proper care is done, if the people have the real and proper and correct information in that regard. For that, we did talk to the spokesperson of the World Health Organization, who gave us the relevant sites, who also said that do not take any medicine when it comes to different diseases. Always go to see a physician. Also, take care when you go to the barber, take care when you use any syringe, and take care when it comes to different issues as far as communicable diseases is concerned. You are the one who can be the first person to prevent such issues, and you can be part of that, a global framework of people who are helping to prevent different communicable, non-communicable and psychological diseases in Pakistan and the world over. Make a change. Mohammad, but bids you farewell from this episode of Diplomatic Enclave. We'll be back inshallah next week, same time, same channel. Take care of yourselves and Allah Hafiz.